everyone, myself Dr. Malika, DNB Family Medicine resident. Today I am going to tell about urinary tract infection, which is the most common problem females facing today. It is most commonly caused by the bacteria called E. coli. The most common risk factors of the urinary tract infection is female. The gender itself a risk factor because females are having the short urethra, which is more proximity to the rectum. And holding urine for a long time is a major risk factor. And patients on antibiotics which kill the good bacteria and promoting that urinary tract infection. Urinary catheterization, you should always take care that you are catheterizing your bladder under all aseptic precaution so that we can avoid the major urinary tract infections. In renal calculi or any other obstructive causes may also lead to the urinary tract infection. You should always maintain the hygiene. You should never use the soaps and perfume. Coming to the symptoms, the patient will be having the burning micturition, which is known as the dysuria. The patient will be having urgency, increased frequency of the urine. The patient may feel smelly urine and discoloration of the urine, whether the reddish in color or dark color. The patient will be having the back pain, fever, nausea, vomiting. In geriatric patient, the urinary tract infection is almost always accompanied by the incontinence of the urine. Coming to the diagnosis, initially we have to do the urine routine examination. If the urine routine examination findings are likely of hematuria, pyuria and biuria and bacteriuria, then we have to send the sample for culture sensitivity. If the urine RM is positive, then we should never wait for the culture result. We can start the antibiotic now itself. The culture will tell the type of the organism and its sensitivity so that we can upgrade the antibiotics accordingly. We can go for the imaging like ultrasound and the CT. In this we can find any obstructive causes or any abnormality so that we can correct accordingly. Coming to the treatment, we have to start the antibiotics like sulfonamides. It should be avoided the patient should avoid the sun exposure if taking sulfonamide, and it should be contraindicated to the patient who are having the allergic to sulfur drugs. And fluoroquinolones is also the most common antibiotic used in the urinary tract infection. Coming to the analgesic in urinary tract infection, we generally prefer to give the phenoxypyridine, which is also known as a pyridium. This generally convert the urine to orange color, so we have to guide that patient or else tell that patient that your urine is going to turn orange, so he should never worry about it. Patient education is most important in almost all disease or the infection, because if the patient is not following the particular rules, the infection will never going to sort out. So we have to tell the patient to take the medication as prescribed by the doctor and promote the fluid intake. Everyone should take at least 3 liters of fluid per day. Good hygiene. Always make sure that you are wiping from front side to the back side, never from back to front. And always tell to avoid the soaps and as well as perfumes. You should always empty your bladder every 3 to 4 hours. You should never hold your urine. Always try to avoid after the intercourse and avoid the alcohol and the caffeine. Some studies have shown that cranberry juice is decreasing the urinary tract infection. Hope you like this video. Thank you.